Hello, I'm Dr. Phillip Myers from Nexus Eye Care, and today we're going to be speaking about cataract surgery. And I have one of Nexus Eye Care's cataract surgeons, Dr. Anagha Vaze, with me. Hello, Anagha.
Hello, Phillip.
Now, Anagha, what is a cataract and how is it treated?
So just to make it easier for everyone to understand, basically a layperson, I'm just going to use an eye model to explain what cataract is. So this is our eyeball, and this is how it looks from inside. This is the front window called cornea, and this is the natural lens inside the eye, which focuses all the visual information on this special film called retina. With aging, this starts becoming cloudy or foggy, or sometimes it just swells up, and that's called a cataract. So it's not a disease, it's an aging change or a degenerative change, if you may.
So what might a patient experience as their lens is starting to become cloudy? What symptoms would they have?
So there are varied symptoms, but few of those would be basically just foggy vision, as if you're looking through a dirty window. That can be one of the symptoms. The few of the other symptoms are difficulty in bright light with glare, especially the oncoming headlights at night can be really troublesome. In general, focusing at different distances, including for distance, intermediate, near, everything might become a bit hard. Frequent change of glasses, all these are symptoms that come from a cataract.
So nighttime glare, general fogginess or haziness. Some people notice as their cataract is developing that the numbers in their glasses are going through frequent changes, and in fact they're becoming, their focusing is changing.
Yes, and that's because denaturation of the protein within the lens, it changes the refractive power of the lens, and temporarily it's often called second sight, but it's actually progressing cataracts. So people are now suddenly able to see close up rather than distance, and that only lasts temporarily until their vision gets disturbed for all the distances, and that's again clouding of the lens proteins. And that's why people, when this whole process is happening, they notice that they have to go and see their optometrists or eye care professionals more frequently for change of glasses, because the prescription or the refraction, as we call, just doesn't stabilize.
And there must come a point where a person's optometrist says, look, I can't change your glasses anymore to get rid of your symptoms. It's time for you to see someone like you who can deal with their surgery. So what exactly happens with cataract surgery?
So cataract surgery is usually a day procedure. The anesthetist will usually do a numbing injection around the eye. Some patients, if they're worried...
Is that painful?
It's not painful at all, because majority of the patients will also get a mild sedative, so it's pretty straightforward, fairly pain-free.
So in fact, you're probably asleep for that injection,
yes.
Which is a comfort to people to hear
Absolutely,
that.
Absolutely. Yeah. So you don't really need a full general anesthetic, but the sedative just calms the patient down. And then, we just do a tiny cut from the side. These days, we use the most advanced technologies with micro-incision. Patients don't need any sutures or any stitches in the eye. We remove the cataractous lens and place an artificial lens implant inside the eye, which then gives them beautiful, crystal clear vision.
So when embarking on surgery, it's really important people know what to expect. If expectation doesn't meet reality, there can be disappointment. So in one sense, I just want to ask you visually, what can people expect? And then I'm going to ask you how much glasses dependency they'll have after surgery. So visually, they've come with glare and cloudy vision. What happens after cataract surgery?
So their vision, especially the clarity, depending on what we have decided as their post-operative target refraction, will be beautiful, crystal clear. Their quality of vision will improve, their color vision will improve, contrast sensitivity will improve, and in general their quality of life will improve as a consequence. And what was your next question?
Question is, a lot of people think they don't need glasses again after cataract surgery. Is that a realistic expectation?
So this is a very good question, and it's extremely important. And to sort of answer this question, the most important part is what are the patient's everyday activities? What are they expecting to do after they get their cataracts removed? And how much or how keen are they on spectacle independence? Having said that, even if they are keen on spectacle independence, not every patient can achieve that after cataract surgery. And the different reasons are, and that's why it's really individualized patient treatment, and assessing and pre-surgery counseling is extremely important. Because that's when we decide, have a detailed chat with the patient and decide on what type of intraocular lens that we implant inside the eye after we remove the cataract is important. So, for example, if a patient who's, say, a truck driver who needs to drive a lot at night might not be suitable for what we call the multifocal lenses as compared to just a monofocal lens, which will give him good central vision. And then I would like to discuss a bit more in detail about these lens choices.
That's a really interesting point you raise, Anagha, about what intraocular lens you're going to place in a patient's eye. You've mentioned a lot depends on their visual requirements, but would you just take us through what is available at the moment for different patients?
So there are different types of intraocular lenses available in the market. The most common one is what we call a monofocal lens, which will either focus your vision for a distance target or near vision target.
So it only does one or the other. So if you had a distance focus, you would need glasses for reading only, and vice versa. So monofocal intraocular lens
can only correct your vision for the specified distance. The second, which is fairly new technology, but more and more lenses are available in this sort of category now, and a lot of patients are finding it quite suitable and helpful, is what we call the enhanced depth of focus lens, which gives you good distance vision and will also give you some intermediate or a computer distance vision, which is extremely important these days with majority of the people spending significant amount of their time in front of the screen. We all need to use computers these days, or while driving, being able to look at the dashboard with fair amount of clarity. And this is what these lenses do. Their optics are slightly modified so that in addition to distance vision, they also give us some good intermediate distance vision.
So these can often be thought of as a monofocal plus. Set for distance with enough focusing to see computer mid-distance without requiring glasses, but still needing glasses for fine print, reading, sewing, threading a needle, that sort of thing. That sounds really good. Is there any lens that will focus for everything?
Yes. So this is the third set, which is called a multifocal or a trifocal lens, which will kind of help you without the glasses to have a fairly good vision for distance, intermediate, and reading, like using your mobile phone or sewing, which you would just without the glasses.
All without, that sounds fantastic. Why doesn't every patient get a multifocal lens so they can see everything without needing glasses?
Now, the reason is because the multifocal lenses have different refractive zones. When I say refractive zones, it means each part of the lens focuses the rays of light at a different focal point. While doing that, it really depends on the lighting conditions as well as the pupil sizes. So, like I gave the example of a truck driver, it's really important in this situation or this scenario, is because if you're doing a lot of night driving, the pupil size changes with the ambient light and with the oncoming headlights. And then the part of the lens which you really need to use for your distance vision, which is important while driving, might not be available for use because of the change in the pupil size. And those patients really struggle. It can also give, rise to significant amount of glare in that situation. And of course, even though it promises spectacle independence, it can come with a slight sort of compromise with the color, contrast, and all those things. So, the type of your profession, or what sort of activities do you do throughout the day really dictates a lot. In addition to that, having any other ocular comorbidities or other ocular problems or diseases, such as, say, for example, age-related macular degeneration or say advanced glaucoma. And when I say this, it is important because age-related macular degeneration affects the central part of your retina, which is the special film at the back of the eye. And that part of the retina is called macula, which is responsible for your central vision. In macular degeneration, there is often thinning of the retina or, an abnormal blood vessel growing there, which compromises your central vision. And in addition to that, if you have like a premium multifocal lens there, it will further deteriorate the quality of vision. And in that situation, that sort of a patient is not an appropriate candidate.
So choosing a multifocal lens or any lens requires a bit of a discussion about the risks and the benefits. There are good points and there are some side effects of the complex lenses. And it takes quite a bit of discussion with a person to settle on which is the best and most appropriate lens for them. Yeah. Are there any risks in delaying cataract surgery?
The majority or the main risk, I would say, would be, significant deterioration in vision, which will affect your quality of life. If it's significant risk in elderly patients, it can be a false risk. It is also, there have been studies which have shown that it can worsen dementia. Plus, ongoing denaturation of the proteins can also make the cataractous lens swell up, which can make the eye pressure go up. So that can lead to glaucoma. Plus, just the more advanced the cataract gets, the surgery can become a bit more complicated. So the surgical complications rate will increase. Considering all these things, these days we don't really wait for the cataract to advance until this stage, and we actually offer cataract surgery when it starts affecting patients' day-to-day activities. And actually, the patients often opt for earlier cataract surgeries these days, in my experience, because they want to enjoy the benefit of clear sight earlier.